Welcome to COVID-19 Safe. My name is Romilly Douglas and I will be your moderator. I'm pleased to introduce today's speaker, Dr. Claudia Mika. Dr. Claudia is the founder and CEO of Temos International. Claudia brings years of dedication to developing and improving the Temos accreditation programs, assessing hospitals and clinics, rehabilitation centers, reproductive care centers, eye care providers, and dental clinics worldwide. Her commitment to quality outcomes, patient safety, risk reduction, and the patient experience, as well as her track record for excellence and innovation, ensures that Temos will continue to deliver value for its clients. Today, Dr. Claudia will be sharing the objectives of the COVID-19 SAFE program, providing a demonstration of Temos online tools, explaining the benefits of the certification program, and then answering your questions. Before I hand over to Dr. Claudia, I have a few housekeeping items to cover about this presentation. First, today's webinar is being recorded and will be made available by email to all participants after the webinar for further review and sharing. All participants will be muted during this webinar, and at any time you may ask a question through the Ask a Question tab at the bottom right-hand side of our player. It's just next to the chat option and it says Q&A mode. We will be answering some of the questions during the presentation. If we don't get to your questions during today's webinar, we'll be sure to follow up with you afterwards. So without any further delay, I'd like to start today's webinar by welcoming Dr. Claudia. Thank you.
Thank you very much, Romilly, for this introduction. A very good afternoon to everybody from Germany. And since I know that we have participants also from the western part of this world, so a very good morning in this part of the world, and a very good evening or even good night already to the east and far east part of the world. Thank you very much to all of you for joining us for today's webinar. I would like to give you an introduction to the Certificate of Compliance COVID-19 SAFE program to minimize the risk of transmission. So before we start with the session itself, let me introduce Temos a bit. Romilly kindly already introduced me as the founder and CEO of Temos International Healthcare Accreditation. Temos is a German-based accreditation body, and we were based research organization in 2010. So we have had our 10th anniversary already this year. And between 2003 and 2008, we already started developing quality criteria for the management of international patients in a big scientific project together with travel health insurances, with representatives from the University Hospital of Aachen, which is near the border to the Netherlands, experts from education and science. And I was the project manager at that time. And after we had developed these different quality criteria and the certification programs at that time, we decided to found a company with it, what we did then in 2010. So this is the reason why I'm sitting here today. I'm being able and having the pleasure to introduce our newest set of standards to you, which is the Certificate of Compliance. So I would like to start with the question, what is behind the certification program? What are the objectives? Why it was created? And how it works. Romilly already said in the introduction that we plan a live demonstration of the online tools, and we hope that it works. Then I would like to give you some points about the benefits of these certification programs and what are the next steps in case you want to download the standards, which is free of charge, or if you want to apply for the certification program itself. We have two parts in between where we make a shortcut. That is after I explained the certification steps and at the end. So whenever you have questions, please make a note. And as Romilly said, use the question function and let us know about all the questions you have. there will be enough time to answer all the questions. So, severe acute respiratory syndrome coronavirus 2. This is the virus which changed all our lives and the complete world as a pandemic. As we all know, and you know that from your everyday experience in your hospital or in the ministry or in the consultancy company where you work, we have the virus, which is called SARS-CoV-2, and we have the disease, which is called COVID-19. In some parts of the world, we are currently experiencing or facing a second wave after we have managed somehow the first wave. And more or less in all countries, we have to deal with this COVID-19 disease based on SARS-CoV-2. So why this certification program? Already in March, when in Europe we had the first wave with severe problems in Spain, France, and Italy, and also here in Germany, we were contacted by some of you as our partners, already accredited by Temos, and asking us, we have to close our clinic or we have to close parts of our hospital. And we now somehow deal with the situation of COVID-19 pandemic. But we have no idea once we are allowed to start again what to do, how to prepare and how to get prepared to offer a safe environment for our staff, for our patients and visitors. So we were asked to help as an accreditation body, and we sat down with the team of experts and said, okay, we have to do something. And at this moment, people are dealing with it already, but what has to be done to get prepared for the new normal, as we all know is now the term in the future. So we defined the standards, or we developed the certification program in response to this COVID-19 pandemic. And we used the information provided, evidence-based from CDC, from the European CDC, from WHO, and even from our own accreditation body, which is ISQA. So we checked all the evidence we could find and summarized it and brought it together, filtered it to make a guideline or guidance, a manual for our partners all over the world. So it was to provide guidance based on international best practices, the regulations we do have in the different countries, and to use the research from the trusted sources I just mentioned as an example. And in the end, to leverage expertise to deliver prompt, coherent, and cohesive standards to COVID-19 specific challenges, which we all face, but we face differently. So these were the main point we wanted to achieve with it. And when we developed and sat together, we said, okay, the situation does not allow every organization worldwide to pay for a certification program. We were quite aware of it. We said, okay, we do this work free of charge, and everybody can register on our website, and some of you have already done, and others might do it after this webinar. You will see the link again. And free of charge, you can just download the standards and the guidance and the explanatory notes free of charge for own use. This was our contribution to the situation worldwide. So this was behind and why we developed the certification program. When we sat together in the expert team, we said, what are the objectives for this certification program? And when you download the standards, or if you have downloaded the standards already, you see there's this in the beginning, in the introduction of the standards document. We defined 10 main objectives, what we wanted to achieve with this certification program. First of all, of course, to this virus, but also to minimize the disease transmission to patients, healthcare staff, and others. And if you remember the beginning, the first slide, it is Certificate of Compliance COVID-19 Safe, minimizing the risk of transmission. So this is the second objective. The third is to identify persons with presumptive COVID-19 disease and implement a triage procedure to assign the appropriate level of care. This is what all of you working in clinics and hospitals had to learn very fast. You are, of course, used to use the triage system in the emergency department, but to use it in dental settings, in reproductive care, in rehabilitation and other parts, this is a new learning for some of you and for the network we are cooperating with. So this was the third objective. The fourth objective was to prevent and break infection chains. So even if we have an infection within the hospital or clinic, that we are prepared by our plans and the management of COVID-19 to break such infection chains. To reduce the negative impact on emergency departments and hospital bed capacity. Of course, this only applies for the hospital setting. Here in Germany, we had increased our hospital bed tremendously just to be able to deal with an increase of COVID-19 patients when they needed ventilation. To maximize the efficiency of personal protective equipment, PPE, used to protect healthcare staff. This, of course, was and still is a very difficult topic. It's getting better, much better worldwide. But from now then today, from today to tomorrow, we had a shortage of PPE in many parts of the world, and healthcare staff had to deal with it. And they had a severe risk of getting infected. So how to maximize the efficiency, even if we have a shortage of PPE, this is something where we want to help with these standards. Prepare for potential staffing shortages. It can be because staff is infected itself, or it could be because family members are infected by COVID-19 or any other disease, and where staff then had to help at home, the family, the neighbors, or whoever. So to get prepared for potential staffing shortages was another objective for the certification program. And we will see that later on in the chapters of the certification program. Then, as I said in my introduction, we were contacted by those or by some clinics who had to completely close down the clinic, and how to prepare for a step-by-step reopening or an increase of patient numbers again with this new normal situation of having COVID-19 risk in the organization. Of course, to achieve a safe and healthy work environment. Most of you, when you're working in hospitals and clinics and do have an international accreditation, you are well prepared. You do have management, disaster management plans. And for some of you, it might have been just a little bit of more work or adjusting such plans. Others, depending on the country and depending on the environment, depending on the management level, we had to give a bit more support to achieve a safe and healthy work environment, and the standards could help here as well. And last but not least, to prepare alternative and supportive services to reduce over-occupancy, which is, of course, a point as well. So you see from these 10 objectives, they are going in different direction, and we wanted to cover them all. And since the first hospitals and clinics have started with the certification program, and we got already the first feedback, we got the feedback that these objectives are the objectives of the clinics and hospitals worldwide, how to deal with COVID-19 disease and the virus. So here, thank you very much for all the feedback we already received, and of course also for you who are listening to today's webinar and perhaps have already had a look in our standards. Your feedback is always very welcome, and wherever we can improve our standards, please let us know later on. What we specifically excluded from this program is the inpatient management of COVID-19 patients. This is not part of the standards. Since we don't know exactly when it really started, if it was January in China or end of last year, or if it, as we heard from Italy, that they found in the water samples already in October, November, the virus in the water. However, you had to learn, and you learned how to manage COVID-19 patients in your hospital. So there are clear structures already implemented, how to isolate, how to treat, what has to be done. The protocols are implemented. And therefore we said we exclude the management of infected patients from these standards, from this program. And this is very important, and therefore I emphasize it here again, just to let you know. So the topics or the chapters that are covered by the certification program, you see here, this is a screenshot from the PDF content list. So after a long introduction where you find explanation on the different risk levels for healthcare workers in the organization, where we added with the version 1.1, which we just uploaded on 12th of June as the first review of the document, we added a part for the testing of COVID-19. So we added the PCR and the antibody testing, what we know so far, into the introduction. You find the scope of the standards again, which means the objectives, how to contribute, how to give feedback, how the standards were developed, etc. This is all explained in the beginning of the document. And then you find in section 1, you find the certification standards itself. You see 7 chapters, and the first chapter, where we have 18 standards, is the standard infection prevention measures during the COVID-19 outbreak, standard precautions, and transmission-based precautions. So these are standard precautions about PPE, respirators, protection, etc. This is chapter 1. Chapter 2 is the management of human resources and the provision of a safe workplace environment. Here we have 12 standards. This is covering how to organize shifts, how to be available, or what has to be done to support your staff members psychologically in these different times, how to perhaps rearrange the workplace to make it more safe. For example, not to use the phone of your colleague. Shift management, as I mentioned, that where possible, always the same shift works together to avoid contamination between different shifts or changing shift members. The third chapter is the patient-centered care during COVID-19 outbreak, screening and clinical management. So here we have the pre-appointment process steps, the triage, the screening when staff and patients enter the hospital or the clinic. So these are the standards which are under this part, and this covers or is covered by 10 different standards. Chapter 4 is facility, environmental and technical resources management. Those of you who are accredited by any international accreditation body knows that this facility management is a chapter you find everywhere. Here we added 12 dedicated tailored chapters, standards, to this chapter for the management of or with the virus and the respective security measures. A completely new chapter, not only in this certification program, but I think worldwide, it's unique. We added for the first time 7 standards for teleconsultation and telemedicine services. And we also implemented these 7 standards to our main accreditation programs in our medical and dental standards. We all had to learn very fast that teleconsultation and telemedicine services are very helpful tools in the communication and treatment of patients worldwide. So within the country, even cross-border, we see in the medical tourism sector, which completely broke down, that teleconsultation services increased tremendously to keep up the communication with patients, to continue somehow follow-ups and many other services. So this is a new chapter, a very important chapter, and is covered by 7 standards. Then chapter 6 is the international patient management and COVID-19. And here we do not have one single standard. All medical tourism related activities were stopped worldwide. So there was nothing what we could add. Second, international patients have to be treated and managed once they can cross the border again and they can travel again. They have to be managed as any other patient as well. So there are at this moment, no specific standards for international patient management and COVID-19. However, in this chapter, you find very useful information about the current status of, or what to expect now when the borders are opening again, has to be expected, how to deal with the COVID-19 situation. Chapter 7 is also unique and a new chapter also for us, which is crisis communication. So here we have 2 standards. One standard is dealing with the communication with the authorities, which I'm sure also changed for you. You're in communication with the authorities more often on a daily basis. There are reporting systems within your country. And the other communication which is needed is the communication with your staff members and from the leadership, and how to communicate this crisis, how to deal with it. So there should be a communication plan which is described in the standards of this chapter. Then you see the section 2, which are guidances. So there are no additional standards, but since we have a very special situation in dental settings and in reproductive care settings, we added additional guidance about the current situation, about the organizations, associations, publications for these 2 topics with additional information. Chapter 10 are the references, and when you see that at the end of this document, you see that we have at this moment 55 references for 61 standards. So all the standards are based on evidence, on references from the sources I showed you in the beginning. It's very important for us, and we always try to update the content of the standards on a regular basis. When you go to the reference chapter, you see also that there is the access date. So it said this reference was accessed on 6th of June 2020, so that you see when we got the information or when we transferred the information from the source to the standards document. At the end, you have the definitions and abbreviations in the glossary, and this is the structure of the certification program. So how does the certification process work? We have 7 steps. That's quite easy. Let's go through them step by step. So first is, and some of you might have done this already, is that you can, free of charge, as I said in the beginning, register on our website. It's free, private, and secure. So you use the link, you just enter the basic data. And since we are located in the European Union, we have to comply with the GDPR requirements, which means that we have to do a double opt-in. So once you enter the data, you receive a notification on your screen that this was successful, that you please open your email and confirm the link. Once you have confirmed the link, you receive another email giving you your individual access code to our website. And then once you have done this, you see this online charts. So I don't know if this is big enough for you. On my screen, it's a bit small. However, you are welcomed, and you can see the following documents are accessible for you free of charge. This is the standards document, the certificate of compliance. You can go into this document, or you can download the standards as a PDF and you can forward it to your colleagues in your organization. And that's it. You can close the the website, and that's it. If you consider and want to apply for the certification program, you can use the second, which is the application form. It's a very short form. Again, you can also download the PDF. You can enter the data online. And once you have entered the data, then you inform us that you want to receive a quotation for your application, and we could start the process. So this is all what you need to do if you want to see the standards. In case of you want to continue with the certification, then the step 2 would be that we provide you the certification agreement. You sign it, and then a 50% prepayment is due to start the process. And once this is done, we come to the certification process step 3, for which I now would like to share my screen with you. So the step 3 says that the orientation and self-assessment is done. This means that you get in the same access you downloaded the standards beforehand. You find more documents. The first one is called Temos certification chart, and the second is called self-evaluation tool. And this is what I would like you to show you now. So please give me a second to open the screen and to share it with you. So you all should now see the login area of our Temos online charts. So this is a code you receive in the email, you receive a password, and you simply log in. So this is how you would see your own access. You're welcomed again, and we here now have 3 different documents. The TIHA self-evaluation tool for the certificate of compliance with checkpoints, and we go into the document in a minute. We have the standards again, the certificate of compliance, COVID-19 safe version 1.1. I mentioned before that we, 10 days ago, after 4 weeks, we had the first update and review. So on a 4 to 6 weeks basis, we continuously update. And next time you would see here version 1.2, for example. And then we have the Temos certification chart for hospitals and clinics. This is a short questionnaire for administrative. Let's focus on what you would have to do in case you want to apply. So go into the document. Here you can always go back home. This shows you, and we will demonstrate it in a minute, that the data has been saved. You entered. Here you can, if you want to share a blank document or the data you already entered into the online system, you can share with colleagues, and here you simply sign out. So what you see here is the introduction and what I mentioned, the scope, etc., etc. With the second part here, we see the first chapter, the standard infection prevention measures during the outbreak, and we see the standards. So here it is always the same order, and this also applies to all our accreditation systems. It's always the same. It's our own database, it's our own online tools, and the system, the structure is always the same. In the first, you see the standard. Here, let's take a short one as an example, 1.2. Signs are posted requesting patients and visitors to immediately report symptoms of respiratory illness on arrival at the healthcare facility. The second part in this gray area gives you further guidance. So SIP 1.2 is the standard. You have to have signs that are posted everywhere requesting patients to let you know if they have symptoms which could be a sign of COVID-19. Here, in this gray area, we have additional checkpoints, which means additional guidance, how you could provide evidence to us that you fulfill the standard. Copies of respective signs and photos, videos from different locations within the organization can be used to provide evidence. Please redact, remove any personal data from documents to be submitted. Very important, this certification program is a desktop assessment. So everything is to be submitted online. We don't want, due to data confidentiality reasons, of course, we don't want to see any personal data. Please redact it before you submit it. So this means you can give us screenshots from the signs, you can make photos with the position of the location where you have these signs. And this can be added here, evidence justifying the rating. And here is the self-assessment you have to do yourself. So if you say we have signs everywhere in the hospital and the clinics requesting from patients that report symptoms, so then you put a fully met here. So two things happen immediately as you see on the screen. This is turning to orange and says data are changed. And now it's turning to green, which means data are saved. And the second change was you see red bars here. As soon as you work on one standard, then this is removed, which is a sign here that it is green. So when you're working on your self-assessment tool, our tool, online tool, gives you some support and help so that you can't get lost somehow and that you can have an additional control by these bars changing from red to green. So if I remove it again, you see this has to be worked on and data were changed and have to be saved. What you have to avoid is that this rotten is getting red, which means that you are kicked off out of the system. This is because you went out for coffee or for lunch, you left the system for too long, and the system, as a protection, as a security measure, kicks you out and you have to start again, sign in again. So the whole system is organized like that. We can go in the next chapter. Then you see the patient-centered care, which I mentioned, has 10 different standards. They are all listed here. You work on them. When you apply for the certification, you also get a separate document guidance for what means fully met, what means met, partially met, and not met, or standards that are not applicable. This is explained differently, and not to waste too much time here, I would skip it now, but there is guidance on this as well. At the end, you see the chapter result. So this means if all the red bars here are removed because you have worked on all the standards, then here automatically you see the chapter result. And you can therefore rate and score yourself, and if you have passed the chapter, based, of course, on the evidence you have to provide to us, and we have to rate and score it accordingly. By the way, the assessors, we call our surveyors assessors, do the same. So they have the same document, the same guiding for the rating and scoring documentation, and use the same basis. Another is then teleconsultation, telemedicine services. It's always the same. If you change here, then you see that it disappears. This is what I wanted to show you from the self-assessment tool. And we don't need to go in the standards document. It is the same, and also for time reason, the short questionnaire where it is only administrative questions about your organization, we skip it here. This is how it works. And I try to get back to the screen. So you should see the screen with the presentation again. Perfect, it worked very well. So let's continue with the certification process step 4. So once you have worked on the online tool and you have submitted all the documents as an evidence for us, we start a technical review simply to check if all the documents are complete. And then we do start the desktop review here. If we have questions, we will schedule a conference call, which can be all the tools we are all familiar now with in the meantime, and we are quite flexible. You might even give us a virtual tour to assure that we can see the signs what we just had in the example. Step 5 would be the certification decision. We have 3 levels: approved, which means passed, then conditionally approved, which means passed under a reservation. You might need to work on a few standards and to provide some further evidence to assure that you pass completely. And not approved, not passed means that we give you some further guidance for improvement so that after some time you can try it again. So we are, and this is important to say, always on your side. And also with these online tools I just showed to you, this is because we are convinced that expensive consultancy is not the best solution to pass a certification or an accreditation. So therefore, we developed all these online tools for the accreditation programs. We even have a long questionnaire where we transferred all the standards into questions, because we think that learning by doing, and learning by doing within your own organization with our support from outside, you can always contact us, is the best option to learn and to implement standards successfully. So even if it would be a not passed, we would not leave you alone. We would help you to further work on the standards and to hopefully be successful in the end. You get the certificate of compliance. It looks like this, and you are allowed to use the stamp of COVID-19 safe organization. And perhaps just a comment here, we say COVID-19 safe and we don't say COVID-19 free. Nobody can guarantee that even if you have all the standards implemented, if you do whatever you can do, that it will never happen that you have a case in your organization. So we do whatever we can do to minimize COVID-19 transmission based on international state-of-the-art, on current research, but we cannot promise, nobody can promise that this is a free organization. This is very important to mention here. COVID-19 safe. Step 6 is receive updated standards. So all the organizations that already downloaded the standards in version 1.0 were informed by us that in their access code, which you saw before, they have the version 1.1 ready for download. It was an email information by us, and again, without any costs, you can just go into your own access and download the new version, and this will continue like this. So we do update the standards, and you can download them free of charge. For the certification program, there's an annual review. The whole procedure or the whole process, the certificate is valid for 2 years. So after 1 year, there's an annual review where we have a short questionnaire asking for any news regarding the COVID-19 management in your organization. You have to reply to it. It's part of the certification program. And then this is the completion of the 7 steps for the certification program. Do you have any questions so far? Normally, you might help.
Thank you for asking, Claudia. There are no questions so far.
Okay, then we continue. Good. Okay, so everything was clear. In the second part, I would like to give you some answers for what is my benefit, what is the added value if I go for such a certification program. And here again, as we had in the beginning, the 10 objective, we have think it's worth to think about it. So first of all, this is a summary of best practices from all over the world. It gives you some guidance and you always get the updates automatically. And regarding the guidance, I would like to give you one comment or one feedback from one organization that already started. They said, Claudia, we are an accredited organization and we do have 90% of your standards already implemented somewhere, some at HR, some in the facility management. But what was missing so far was a structure on how to deal with this COVID-19. So it's really a guidance, and this is what we used as a template somehow to implement what was missing and to give it a structure which was missing before. So this is some of the feedbacks we received. Then we think that they are comprehensive. It's only 61 standards, and those of you who are familiar with accreditation know that our other accreditation programs have 400, 500 standards, but they are comprehensive and they are innovative, as I mentioned, with the crisis communication and telemedicine standards. So we give a lot of explanatory notes, a lot of remarks, explanations in addition to the standards themselves to make it as understandable and comprehensive as possible. You always have during the process access to our experts. So if you have questions regarding a specific standard, we will find, hopefully, and in most of the cases, we'll find one of our experts who will answer your questions regarding this. I hope in the shortage of time I had that you find the online tools simple to use, as we know from all those partners and clients who did and have been using the online tools, that they are really simple to use. It's a secure environment, so data are safe according to the very strong data regulations or data confidentiality regulations we have in Germany. It's an independent third-party verification, as it is common for certification and accreditation bodies. And it's, of course, expert-led verification process. So experts are checking your submitted documents and give the feedback and do the rating. They are trained, they're all trained by myself, and it's an international team. They speak, I don't know, 100 languages altogether. They have been working in so many countries. So it's an expert-led verification. We think that it's affordable and transparent pricing, what we have here. So we publish the fees for the certification on our website. There is the fee calculator where you can see, according to the number of beds or the organization, the medical service level, it's clearly stated what the prices would be for the certification. Once you start the certification program and we get to know each other, we think that this is a good basis to also offer a discount for the Temos accreditation. So if you want to start with a certification, you like the way we do it or how you can get access to standards and the way Temos accreditations are structured, then this is our part in the future that we will be willing to give you a discount for Temos accreditation. We are quite active in social media. Some of you found us in the social media, and this is what we will not stop once you're certified. So we have our accredited partner guide where you are listed as a certificate of compliance organization. We do have press releases, we have our newsletter system, we have social media, we are on Facebook, on LinkedIn, on Twitter, on YouTube, and I don't know on how many social media. So we will spread the message that the organizations are certified. And last but not least, I think, or we think in the team, that it is a privilege and it should be your competitive edge to be certified by Temos for the COVID-19 safe. So to stand out from the crowd and to show not only your staff, but also your patients, visitors, that you are safe as an organization can be in this crisis of COVID-19. So this would be the second part for any questions or comments before we come to an end. So it's the 45 minutes I wanted to talk. So I covered them with hopefully useful information for you. So it's time for your questions.
Thank you, Claudia. So we have one question today, which I will so far, which I will just publish. Let's have a look. I'm not sure if you can see it. The question was, are these standards ISQA approved, which is ISQUA?
Yeah. So the answer is no. They are not accredited by ISQA. I submitted, or not, I didn't submit, I just forwarded ISQA the standards, and they said they are, they could be approved, they could be certified or accredited by ISQA, but also for us it's a question of financials, and so we just were happy with the feedback that content-wise they could be approved by ISQA.
Thank you for answering. So next question is, what is the difference between the Temos program and the other certification programs available?
As far as I know, there are no other certification programs offering such a certification program. So this is unique worldwide.
Fantastic, thank you. And that's all the questions we have so far. Just hold on and see if anyone else has anything. Yeah, we have another one. There we are, from Jenny. Can these standards be adopted by regulators of healthcare facilities?
Sure. I mean, I see from whom the question is coming. So yes, they are available free of charge. You can download them. What you should keep is copyright, or you should get back to us. And we are more than happy to help if they should be adopted or included somehow from regulators. We are happy to help. Just get back to me. The person who asked the question has my personal contacts, so please get back to me directly. Will be a pleasure. Sure.
Thank you. I think that's all the questions we have for today, and I just wanted to thank everyone for attending today's webinar. We hope that you found it informative. Some of you did say there were some technical difficulties online, but we will follow up with an email with a recording of today's program. So please check your emails for that. Thank you all again for attending, and we look forward to seeing you again in the future at one of our programs. And have a great day and stay safe, everyone. Thank you, Dr. Claudia, for today.
Thank you all for joining us. And whenever there are questions afterwards, please get back to us. And here is just the link also for the registration, again, if you want to download the standards. This is, as I said, the double opt-in, so you have to wait for the email, and you might also check your spam if there is an email coming from us, so that you confirm the link. Okay.
Thank you very much, and we'll follow up with the questions that people are asking now as well by email. Good. Thank you. Good. Take care.
Take care. Bye-bye to everybody.